Hello and welcome to the Budget Countdown. I'm Shireen Bhan. Today we turn the spotlight on healthcare and pharma, a sector whose importance has surged by leaps and bounds since the start of the COVID pandemic. While the second COVID wave in April and May last year exposed the lack of adequate medical infrastructure in India, more and more people are now being afflicted with lifestyle disorders. Last budget, Finance Minister Nirmala Sitharaman allocated approximately 71,000 crore rupees for health and family welfare, while allocating 35,000 crore rupees separately for COVID vaccination. With the pandemic still far from over, industry veterans and healthcare experts have been asking for a higher allocation towards the sector along with tax incentives. We will come to all of that in a bit. But first, let's go across to my colleague Sapna Das, who's standing by with her analysis of the healthcare budget. Sapna.
Well, as you rightly pointed out, 71,000 crores is the allocation for the current year's budget. But if you compare these numbers from the last financial year, so you will see that every time around the RE stage, the numbers really go up. And, because of COVID, basically, the expenditure, the additional expenditure flowing out on that front. So FY21, 65,000 crores was the budget size. The government ended the year with somewhere around 79,000 crores worth of spend. Again, this year in the BE, it was slightly lower at around 71,000 crores. But again, the important point is that in the first supplementary demand for grants, the government has given an additional outlay of 17,000 crores to the health ministry. So that's a big jump in terms of the actual size of the budget. It's close to around 88,000 crores, 9,000 more than the RE of last year. So, that's a big, significant number that we're talking about. And remember, the year is not over yet. We're already talking about the third supplementary demands for grants, and we have to watch what kind of RE numbers the minister puts out in the budget on Feb 1. Apart from this, however, if you look at the actual flow of funds, so as per the CGA data up to November, that is, only 63% of the funds have been used. That is around 45,000 crores. So this may actually indicate that basically states will take their own time to, kind of use this additional money that's coming in from the center. I suppose that takes its own time. Plus, also you look at the vaccination budget, 35,000 crores. Government has been indicating at various points in time that, this is going to be exceeded. But I don't think that is going to be a big one to watch out for, around 5 to 7,000 crores maximum, even taking into account the precautionary dosage that is on right now, to some parts of the population. So all in all, I don't think vaccination is the real thing. The real issue is in terms of what is the expenditure under the National Health Mission, and also in terms of COVID expenditure, how is that panning out, whether the states are actually able to utilize these additional funds.
Absolutely. Sapna, many thanks for joining us and taking us through the allocations and what has been spent. Joining us now, Kiran Mazumdar-Shaw, Executive Chairperson of Biocon and Biocon Biologics. Also with us on the program, Sunita Reddy, Managing Director of Apollo Hospitals, and Professor Srinath Reddy, President of the Public Health Foundation of India. Professor Reddy, Kiran, Sunita, many thanks for joining us. Professor Reddy, let me start by asking you, to start with your assessment of where we find ourselves in the trajectory as far as the Omicron wave is concerned. Large metros, of course, being impacted the most, but we're now starting to see perhaps in metros like Delhi and Mumbai, cases decline, even though the positivity rate continues to be high. To start with your assessment of where we are in the Omicron wave.
Well, the big cities are the first ones anyway to initiate a new wave, particularly when the variant arises from a foreign country or different foreign locations. And then it starts spreading to the neighboring districts and then to smaller towns and villages. So we are likely to see the progression of the wave elsewhere into India, even as the big cities are now showing a decline. And the whole wave may take a few more weeks to unravel in terms of its overall magnitude and then recede. And therefore, we ought to be prepared for it. But fortunately, so far, whatever are the reports from the big city hospitals suggest that it's relatively mild in terms of its overall impact of severity of individual disease, though very large numbers getting infected may still overload the system, and not only merely for testing and home care, but also sometimes for hospitalization of that small fraction, which is likely to get seriously affected. So we still ought to keep up our vigil and hope that the wave will pass soon without causing as much devastation as the second wave. It does appear that it will be milder than the second wave, but we still need to keep up our guard.
Absolutely, and the hope is that we will perhaps get through this particular wave with less devastating impact that we saw through the course of the Delta wave. But Professor Reddy, let's now talk about your expectations from Budget 2022 when it comes to healthcare and pharma. As my colleague Sapna was pointing out, we did see a 71,000 crore rupee allocation for the healthcare ministry, which was then additionally supplemented in the supplementary demand for grants, taking the total to 88,000 crores. But that hasn't been spent yet. So it also brings to question the absorption capacity as far as the healthcare ecosystem is concerned. So what's your hope and your expectation?
Well, basically, the utilization depends not only on the allocation, but the capacity that exists within the health system for absorbing and utilizing it efficiently. And that is where we have been hamstrung, not only with inadequate infrastructure, but much more so with the lack of human resources who are available. Because unless you have a multi-skilled, multi-layered health workforce available in adequate numbers at different levels of the healthcare system, you are not going to be able to utilize it appropriately. Of course, you do require the infrastructure, you do require essential equipment, drugs and vaccines, and you also need good management systems to add the efficiency gains of proper management for whatever is allocated and utilized. But I believe we have been spending a lot in terms of capital expenditure, very much needed, there's no doubt about it. We do require better infrastructure. But all the infrastructure that we create and the digital health mission and the capacity that we create for digital health would still be underutilized if we do not have an adequate health workforce. So what I would like to see is that there should be a greater investment in the buildup of the health workforce and on strengthening the district hospitals in particular, make them centers for training of allied health professionals, nurses and doctors, particularly in those states where you do not have adequate capacity either for producing doctors, nurses or allied health professionals. So I would like to see a lot more attention on that. I'd also like to see a lot more attention on urban primary healthcare, apart from strengthening the rural primary healthcare. Indeed, the 15th Finance Commission had allocated funds to the urban local bodies and the rural local bodies, but emphasized particularly the absence of adequate urban health workforce and the lack of a proper design for urban health. And that is where I believe we must spend a lot more.
Yeah.
So apart from capital expenditure, I'd like to see a lot more being spent on this. And lastly, the Pradhan Mantri Jan Arogya Yojana previously did not see much of a rise in allocation because during the COVID period, the non-COVID utilization was very little because the demand for non-COVID care was very limited during the COVID period. That's not going to happen once COVID recedes. So we ought to really increase the allocation for non-COVID care as well and ensure it's properly utilized across the country.
Yes, several important aspects that you bring up there. Remember, the government had announced the Pradhan Mantri Atmanirbhar Swasthya Bharat Yojana.